Hi, my name is Hannah Hughes and I am a sudden cardiac arrest survivor and also a family and couples therapist. Today I want to address the question, if you've been through a cardiac event, if you've experienced a sudden cardiac arrest, a major heart attack, or even open heart surgery, and you're going through cardiac recovery and finding the emotional aspects quite difficult, struggling psychologically, how do you know if family therapy will be a helpful intervention to support you during your recovery? So this is a good question, and it's not as simple as it sounds. I think we have to start by thinking about what is family therapy. Family therapy is a little different from other therapies because you invite family members into the sessions. And family therapy focuses on improving the communication between family members, encouraging different members of the family to understand each other better, to increase the openness in their communication, to increase the connection in the family, the love, the warmth, the support, to iron out misunderstanding between family members, and to generally appreciate what experiences other members of the family are going through in order to create a more supportive, open, and warm family context. So when it comes to a cardiac event, I know these cardiac events are quite different. Sudden cardiac arrest and a heart attack are really very different in terms of how you experience them and what the repercussions are. But even open heart surgery, all these events don't happen in a vacuum. They're not an individual experience. They happen in the context of people and their close relatives and their friends, and relationships can be significantly affected by these traumatic experiences. For example, following a cardiac arrest, a person might feel quite traumatized. Their anxiety might increase significantly as they are worried about whether this sort of event can happen again, or worried for their own mortality, concerned about what their future might look like. And equally, their functionality might have decreased considerably. They might not be able to do many of the things that they used to be able to do prior to the event. And so this in itself has a knock-on effect on their close relationships. A partner, for example, who might have been quite equal in terms of the care that they gave each other, might now have many more caring responsibilities in relation to their partner who's a cardiac patient, due to their illness, due to chronic illness, due to ongoing fatigue or functionality issues. So relationships really can shift, and family dynamics really can change, not just in the aftermath of the event, but also longer term. Dynamics can change and shift, and there can be quite a high level of distress when that happens, and quite a high level of misunderstanding between family members, which can cause even more distress. So that's one aspect of why the experience of a cardiac event isn't just an individual experience, but it's also a relational one. And so sometimes targeting the relational component can ease the distress of the experience itself and can ease the distress during recovery. Equally, if somebody has experienced trauma or is highly anxious or experiences low mood following a cardiac event, sometimes they withdraw from other people. Sometimes they feel quite isolated. Often people who've experienced cardiac arrests have never met somebody else who've gone through a similar experience. So they really can feel quite isolated and not know if their thoughts or feelings are normal, or if their thoughts and feelings are something they should be worried or concerned about. And that isolation actually increases the low mood and makes things harder and makes the difficult feelings compounded. And so family therapy really can support family members to reach out to each other and learn how to support each other in different ways. Following a really difficult event, family members may each react very differently. Whereas one family member might want to speak a lot about the event, another family member may not want to talk about it at all and may keep their worries to themselves. And equally, they can misunderstand each other because you communicate not just with your words, but with your behavior. So they can misunderstand each other's behaviors, and this can lead to more distance within family relationships. So family therapy really can support that process to increase communication and therefore encourage people to speak more openly about their more difficult feelings. And this in itself relieves the distress and enables people to feel more supported. I think there's one more aspect about how family therapy could be helpful, which is when a dramatic event occurs in the family and when people are really thinking about difficult questions, facing possibly end of life questions, or thinking about survival guilt. Why did I get through this cardiac arrest and somebody who I'm close to, I'm related to, wasn't so lucky? Those really difficult questions, often to process the event, it's helpful to have a space where everybody can reflect on what happened and try and get their heads around it together in a connected way, in a way where people can support each other through that really difficult process to come to terms with the events and what they might mean for themselves and for the family as a whole. People's identity can be really significantly changed, and they can rebuild their identity following a cardiac event. And this happens relationally as well as individually. So people can really find family therapy very helpful when discussing these sort of situations and how to move forward, how to develop a new normal in their life and in their future. Another aspect of family and couples therapy in particular is the couples relationship. And a specialist couples therapist can really support a couple to regain intimacy following a cardiac event. Illness often creates distance. People can't necessarily be as close to each other physically and possibly not emotionally because they feel too vulnerable. And so with a good couples therapist will really support a couple to think about how to rebuild their connection, how to regain their spark, and how to learn how to develop more intimate feelings again and a freshness in their relationship that perhaps has been quite difficult given really challenging circumstances. And how do you find a family therapist? You can either go on the AFT website or the UKCP website and browse through and select which therapist you think might be appropriate for you. Usually the therapists allow you to speak to them for a few minutes to connect with them, and you get a sense of whether you feel like you're going to be able to get on with them and they might understand your situation. And also in the UK, the NHS for mild to moderate low mood and anxiety offer CBT, but also offer an intervention called couples therapy for depression. And that's a specific type of couples therapy where you're focusing on relieving the distress of low mood and encouraging people to be more positive and to feel better, but it's done through a relational angle. So it's through a couple learning to understand each other and to increase their connection and their warmth and their openness in their intimate relationship. And through that angle, it relieves them of distress and allows them to feel better and feel more positive and to understand their anxiety and to come to terms with what's happened. So I hope that's been helpful. Looking forward to being in touch, and best of luck in your cardiac recovery journey.